What's going on, everyone? Welcome back to my channel. In today's video, we'll be looking at 4 exercises for degenerative meniscus tears in the knee. So if you have knee pain, maybe you get some swelling in your knee, you might be someone who plays tennis or pickleball and it kind of flares up afterwards. Maybe you twisted your knee and now it's painful and swollen. If any of those apply to you, then you'll want to stay tuned for today's exercises. Before we get into the exercises, just want to talk a little bit about degenerative meniscus tears. So the meniscus is a fibrocartilaginous structure in your knee. It's basically a shock absorber in your knee. It also provides stability. They are sort of C-shaped. We have a medial and a lateral meniscus, and people can have tears in them. They can be traumatic. We see this in athletes. Sometimes they're maybe playing soccer. They plant and twist and injure their meniscus. Most meniscus tears are degenerative, which means that they just sort of happen with aging. There wasn't a specific injury. We see a lot of people in kind of middle adulthood, maybe like their 40s or 50s, who have knee pain. They have an MRI and they see that there's a degenerative tear. The really interesting thing about these is that about half of the population who don't have knee pain actually have meniscus tears, these degenerative meniscus tears. So if you've had an MRI, you have to kind of take those results with a grain of salt. If you have knee pain and you have a meniscus tear, a degenerative meniscus tear, maybe it's associated with your symptoms. It could also just be associated with kind of the normal aging process. The meniscus doesn't heal well either. So if you have an MRI and have a tear and then you go through rehab, and if you were to do another MRI, it probably wouldn't change a whole lot. And it's actually really not a big deal. Most people can get rid of their pain, get their mobility and strength back, and go back to normal life for the most part, even if that meniscus tear is still there. So just information that's important for you to know as you go into this. A lot of people are like hoping that rehab, they're expecting that their meniscus is going to look perfect again if they have another MRI. That's just not the reality and really doesn't matter in most cases. All right, starting off in the rehab process, we really want to work on knee mobility. If you're in the acute stages, this is really flared up, or you notice some swelling, you just really want to make sure you're working on your mobility. This is going to help to reduce pain and make sure that you don't develop any stiffness in your knee joint. So our knee really has 4 motions to it, but we're going to really just focus on flexion and extension. Those 2 movements are most important. And the exercise we're going to do here, I'll do all the exercises on my right knee, so just reverse everything if it's your left side. This is called a heel slide, and what you're going to do is just slide your heel and bend your knee as far as you can. So bending the knee is knee flexion. When you get to a point here, your hamstrings won't be able to pull in any farther, so you can use your arms to pull up as far as you can. Normal knee flexion is somewhere between 135 degrees to 145 degrees, so that's kind of what you're working towards. Everybody's normal is a little different, so just compare to your other side. And then you'd slide back out, and this is full knee extension. We should be able to get the back of the knee pretty close to the ground. Again, just compare it to your other side. Sometimes people, when they've had an injury to their knee, they won't be able to get full extension. They'll have a little bit of a space here. So just work on over time, going back and forth, trying to really get maximum flexion and maximum extension. You really don't want to lose either of these movements. So it's important to just kind of go back and forth here. Usually we'll have people do 10 to 15 repetitions and do this 4 or 5 times throughout the day just to keep the joint moving, work on that mobility and reduce pain. Only take it as far as you can. You know, just go right up to that barrier of pain. If I hit pain right here, then that's fine. I'm just going to work to that point and kind of go in and out. Usually when we see people in rehab, every week they'll gain more motion. So they might gain 10 degrees of bend each week. Maybe they gain a couple of degrees of extension. So just stick with it and it will get better. So 10 repetitions, 4 to 5 times throughout the day. The next exercise will be an exercise to start activating and strengthening our quadricep muscles on the front of the thigh. The quadriceps are the most important stabilizer of the knee joint. And when people have knee pain, oftentimes we'll see what's called arthrogenic inhibition, where basically our nervous system shuts down the quads, sort of inhibits them to help protect the knee joint. So we really want to work on getting those muscles back online. And this exercise is called a short arc quad. You're going to put a foam roller under your painful knee, and then you're going to squeeze your quads and basically just straighten your knee, hold an isometric at the top for 2 to 3 seconds, and then slowly go back down. So this is also called a leg extension, right? If you've ever done the leg extension machine at the gym, you're essentially doing that, but you're only doing a partial range of motion. So this is where we'll start. You're going to go for 3 sets. of 10 to 15 repetitions, moving nice and slow, and really thinking more about, this isn't much of a strengthening exercise, it's really more of just a motor control sort of activation exercise, really just thinking about getting a good squeeze in those quads, getting them back online. As this gets easier, you'd go into a chair, so into a seated position, and work through that full range of motion. So you'd sit in the chair, bend your knee to 90 degrees, and then go all the way up to where it's straight. So that's our second exercise, a short arc quad or leg extension exercise. In the third exercise, we're gonna strengthen our gluteal muscles, gluteus medius and gluteus minimus. We have a lot of research for lots of pain conditions showing that strengthening the glutes can really help. The glutes are a major stabilizer and supporter of the entire kinetic chain. They help to control our knee joint, so we wanna add these in. So for this one, it's called side-lying hip abduction. If my issue is on my right leg, I'm gonna lie on my left side. So I'm gonna lie down here on my left side, and the setup for this is important. So again, I'm working my right leg, I'm gonna straighten my legs out. First, what I wanna do is put my hand up here on my pelvis and kind of roll forward. So log roll your whole body forward. And then I'm gonna be lifting this top leg up and back to the corner. So hip abduction and a little bit of extension. So I'm gonna go up and back, and I'm looking to squeeze the muscles right here. Again, gluteus medius and gluteus minimus. They are our primary hip abductors, so they're responsible for bringing the leg away from our side, away from midline. And then when we're standing on one leg, they help to control our pelvis and this big long femur bone, which is half of the knee joint. So again, this is where if we strengthen these hip muscles, it will help us control our femur, which will ultimately give us more knee stability. So for this one, this is definitely more of a strengthening exercise. These muscles are pretty small. Doing a set of 10 or 15 of these is gonna create a pretty good burn right here in your glutes and strengthen these muscles. So I tell people go for 3 sets, 10 to 15 reps. This is one that's really great to do on both sides of your body, even if your other side is pain-free and healthy. Strengthening gluteus medius and minimus has a ton of positive effects on our low back, our hip, and our knee joints. So again, 3 sets, 10 to 15 reps, and this is our third exercise, side-lying hip abduction. Before I get into the last exercise, just want to mention that my book's available on Amazon and Barnes & Noble. It has comprehensive rehab programs for the 50 most common orthopedic issues, pain issues, and injuries. Each body region has its own chapter. So for instance, today we're talking about meniscus tears. If we go back to the knee chapter, you'll see that there is a knee instability program that addresses meniscus tears. So every program is going to talk through the issue, explain common signs and symptoms, and then explain what you'll be doing in the treatment program. As you can see, the program has 3 phases. All the exercises have pictures of me doing them. So it's really a program that's going to guide you through the complete physical therapy process. My YouTube videos help a lot of people, but they're, of course, they're not a comprehensive program. It's only 4 or 5 exercises. So if you'd like to have a resource at home that allows you to manage the most common pains and injuries, I will put a link for my book down in the description. All right, the last exercise here is another strengthening one. This is going to strengthen our quads and our glutes. Remember, the quads were those important knee stabilizers, and our glutes, as I just explained, help to control the hip and knee joint. This is called a split squat. What you're gonna do is put your painful leg in front. So if my right leg is the painful knee, I'm gonna put it out and kind of get into a wide stance, hands up here on my pelvis, and then I'm just gonna drop my back knee straight down to the ground. Try not to slam it, just go down to where it touches if you can go through full range of motion. And you're really thinking about most of the work being done by your front leg. So I'm using my quads and glutes here again to slowly descend and then squeezing those muscles to come back up. Now, if your right knee is really painful, if your knee is painful, that front knee, you might be able to only go through partial range of motion. So maybe just go into there and back up. Just go through the range of motion that you currently have available. Don't push in, past mild pain. Just go to that point, and as things kind of calm down, you'll be able to go through a deeper and deeper range of motion. You can also hold on with your opposite side arm if you're near a wall. If you need a little bit of balance, especially while things are hurting, you might need just a little bit of arm support. So I can use my left arm here while my right knee is in front to increase my basis of support and give me a little bit of extra balance. So over time, try to stop using that arm, and again, down through as far as you can, getting near the ground, and looking at 3 sets of 10 to 15 repetitions. Okay, so those are 4 exercises that often help people with degenerative meniscus tears. Give them a try. If you have any questions, put them down in the comment section, and I will see you guys in the next video. Bye.